Well, a lot of people are fearful for many reasons when it comes to being on medications, and it's commonly believed that the more meds you're on, the worse off your health actually is.
9 News medical expert Dr. Pao Coley joins us this morning to discuss this. Thanks for coming in.
Good morning, guys.
This is interesting. A lot of people are skeptical of the medical system and using more medications. So talk about that.
Yeah, it's been kind of interesting because it's been an evolution. It used to be that the doctor, what they said was the holy grail. You trusted it. And I think over time that's been sort of chipped away at for a number of different reasons. The opioid crisis was big in this and creating sort of a mistrust of pharmaceutical companies and of the medical system. But I also think the pandemic and social media have created this culture of sort of misinformation online where you don't know who to trust. So what the doctor says now doesn't always necessarily what you take at face value. And when it comes to doctors giving medications, people often perceive them as being pill pushers. And so there's a lot of skepticism. I have patients every single day that push back on me and say, I don't want to take medicines because I don't want to be on a pill for the rest of my life. But I think that sort of thinking can really interfere with good medical care.
And of course, because of that, there's also a culture of people that say, well, we want more natural remedies, right? As opposed to being on some kind of medication. What do you say to somebody that this is their mindset?
So I would say that that's partially true, but partially false. So I acknowledge that our medical system is broken. We do not take enough time to advise people on natural remedies and solutions because we're pressed for time. We're working on it because the new hypertension guidelines for high blood pressure actually have a whole section on diet, on potassium, and all the things that you should be doing naturally to help reduce your blood pressure before you start giving somebody medications. But I think part of this is also a problem of perception. We overestimate the risks of medications and underestimate the risks of supplements, which are actually more hazardous to your health, don't prove to make you live longer, can also cause problems like liver toxicity and such. But because they're available over the counter, we sort of think that they're safer.
Yeah. What is the best strategy to treat blood pressure?
Yeah, so this is what this study found that was really interesting. We've been doing it wrong all these years. So as a cardiologist, I always used to start one medicine, max it out, then start a second medicine. And as a patient, you feel better because you're only on one medicine. But now we're saying instead of using high doses of single medicines, and what the study showed is that using small doses of multiple medicines actually tricks the body better, gets your blood pressure down faster. So putting somebody on three medicines at low doses rather than one medicine at a super high dose actually gets your blood pressure treated faster. So this is where we need to kind of come to terms with more medicine is not necessarily bad. You actually want to use perhaps different types of medicines in smaller doses.
The only thing I have a question about regarding that, though, is cost, because now you're talking about 3 different medications, right?
Right, and that's where we need to do better because now they're working on what's called poly pills for heart disease, where instead of you taking a fistful of pills, you take one tablet that has all the different medicines in it that you need that are combination medications. And we really want to try to put generics in there and not brand names, because you're right, as you start to layer on brand name medicines, it can get really expensive. But psychologically, somehow we feel better if we're taking a single pill rather than taking a whole bunch of pills.
Yeah.
But I think it's really time for us to sort of change how we think about treating disease. And so if you have high blood pressure or high cholesterol, I would urge you to talk to your doctor. You're only on one medicine, about whether it might make sense to switch your doses and put you on multiple medications and really sort of change your thinking around how to take pills.
What are the other takeaways for patients if, should they push back? Should they ask questions? What other things should they be considering?
Always. You always want to say, is there a natural solution? And this is pushing your doctor to provide some of those natural solutions to this, but at the same time, don't be in denial. Because if you've tried the natural way, it hasn't worked, or you feel like the natural way is not going to get you where you need to get to, you have to drop your blood pressure 50 points. That's not going to happen naturally.
Right.
Then you want to reach for the medicines early, because our body is like, I always say it's like an old car. As it gets older, you need to give it a little more TLC. You need to do more things to it to keep it running smoothly, but not doing those things just because you don't see the symptoms right away could be damaging. So ask about natural solutions, but be ready to pull the trigger on those medications, and don't reach for those supplements unless your doctor recommends them.
All right, Dr. Coley, we appreciate you coming in and breaking down that study. By the way, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.